So I'm here with the Ask Me Anything series on COVID, and I'm with Kier. She's a professor in the College of Pharmacy at Ohio Northern, and she has her PhD in epidemiology. And Karen, our first question is, when someone dies of the virus of COVID or the coronavirus, is there still a danger to the public in getting the virus from the deceased?
That's a great question. And, you know, as we go on and gather more information, we learn more. And initially there was information that came out of Thailand where there was a physician who actually they thought had gotten the virus from a deceased body. The recommendations have changed a little bit as they've started to kind of trace and look at the information. So the best information actually comes from the mortuary science individuals who have looked at this, and actually where they have documented that people have gotten the virus from the deceased, it actually isn't that. So the morticians who have been working with the bodies they've traced back, have gotten the virus from family members who they've been in contact. So those family members were in contact with the deceased, got the virus from the family member, and then were transmitting it to funeral directors and morticians that were working. The mortician, the science behind it, they do recommend, though, with the deceased body that they not manipulate and not expel air out of the lungs immediately after death. So you still are going to handle the body with caution because we are dealing with an infectious disease. But really it's a live transmission, droplets again, air coming from the lungs of those that have been exposed to the person that has passed away from COVID. So again, you always want to err on the side of caution, but typically it is from transmission of family members with the deceased. But good question.
Thank you.